All right, awesome. Welcome everybody. Today we have a very, very special topic, Medicare 101. So dust out those notepads and get ready to go back. It's back to school time too, right? So get ready to get back into the classroom for this one. Medicare is something that is obviously a very, very important topic because it affects just about everybody in retirement. So while Marcus and I really specialize in kind of looking at your overall financial picture and overall retirement picture, Medicare is an area that we always want to address and want to tend to, but we recognize that we're not necessarily the experts there. And so that's why we wanted to also introduce everybody to a good friend of ours, a colleague with she's with GHT Insurance, which is an independent insurance broker here in the Richmond area. And you may see already, her name is Jennifer Schloss. Jennifer has been, she's helped a number of our clients over the past few years. And, she's been working in the Medicare industry for coming up on a full decade now. And she is just a wealth of knowledge. So, definitely, use her time today, but also if you have questions and things that you're wondering about, afterward and how this kind of all applies to you or to your family member, definitely schedule a time to talk with her directly as well. She's always, available and, can help you out one-on-one with any questions that you have. So without further ado, I will kind of pass things on over to Jennifer to get things started and walk us through today's session. And again, any questions that anybody has, definitely throw those into the Q&A box as well.
Great, perfect. So it's going to be about 35, 36 slides. I think we're going to go through Medicare 101. Some of this you may be already familiar with if you're already on Medicare. There's lots of nuances to different aspects when it comes to Medicare. This is just going to kind of touch on all the basics. If you have something specific that you want to talk about, a really in-depth situation going on, I am open, reach out, email, call me. I'm happy to do that. This is a Medicare 101, so it's really touching on the basics of kind of everything. And probably each page of this could have its own educational discussion on it, but we're just going to go through things briefly. We're going to touch on who's eligible for Medicare, the coverage options with Medicare, where you can enroll for Medicare, the next steps once we go through everything, and then, of course, any questions that you have. So the first thing is who's eligible for Medicare. Medicare is one of those things you don't really think about when you're young and working. It's kind of like, that's going to be in the future. But like Emmett said, most people will be eligible for Medicare at some point, and it is something you're going to have to plan for, whether it's the financial aspect, the health aspect. Medicare is going to come into your mind at some point. With me, it started with a parent. That's how I became familiar with it. Then I was working in it, and then it was like, oh, okay, everything started to click. But just to know, like, who's eligible for Medicare, you must be a U.S. citizen or a legal resident for at least 5 consecutive years and one of the following: age 65 or older, under 65 with a qualifying disability, or any person who's been diagnosed with end-stage renal disease or ALS, Lou Gehrig's disease. So anyone who meets those qualifications is qualified. The coverage options for Medicare are a little bit tricky. This may be where you kind of want to write it down if you're not familiar with it, or if you're already on Medicare, you've touched on these things before. You're dealing with your Part A, your Part B, your Part C, your Part D, and then of course Medicare supplements, and those have their own set of letters basically, but those are the coverage options. Original Medicare is your Part A and your Part B. That's that red, white, and blue card that you get in the mail. I'm eligible for Medicare. You get the card. It might have just A on it. It might have both, A and B, but that's original Medicare. That's the federal program. So Part A is your hospital insurance. inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Part A is premium free if you have worked 40 quarters. So when you were a teenager and you got your first job, you might have seen Medicare on your tax, on your pay stub where they were taking the taxes out for it. Basically, you have been paying into Medicare throughout your working life. If you don't meet the qualifications for working the 40 quarters, or but you have a spouse who does, because many times there may have been a stay-at-home parent, and so one spouse was working, one was at home, you would still qualify for premium free if you've worked at least 40 quarters over the course of your lifetime. There's a $1,600 deductible in 2023. There's going to be certain numbers that I talk about throughout the presentation that change from year to year. This is one of them, which is the deductible for hospitalization. So this year it's $1,600. The coverage is for stays of more than 60 days have daily copays. You can utilize any hospital that accepts Medicare, and hospital coverage outside of the US is not usually covered. The other part of Original Medicare is your Part B. This is the one that you are going to want to pay attention to. There's costs associated with this one when you sign up for Medicare. This is your medical. So it's doctors and outpatient visits. It's going to cover physician services, outpatient hospital services, ambulance, outpatient mental health, lab services, durable medical equipment such as wheelchairs, oxygen, etc., outpatient physical, occupational, and speech language therapy, and then some preventative care. So one of the things about Part B is that there's cost sharing involved. If it's approved by Medicare, it's a medical service. Medicare generally pays 80%. You're responsible for the other 20%. So the costs are, there's no out-of-pocket maximum. There's no out-of-pocket maximum on, what that means is there's no cap on that 20% that you could owe if you were just to be on Original Medicare. So no out-of-pocket max. You pay 20% of Medicare approved costs. The annual deductible this year is $226. In the fall, we're going to find out how that changes. So every year they come out with the new premium for Part B. They come out with what the deductible is going to be. And this year it went to $226. The monthly premium, it is adjusted based on your income and may be higher if you sign up after your initial enrollment period. Basically, if you're eligible for Medicare and you don't have creditable insurance, meaning that you have insurance that Medicare considers creditable through, say, an employer or a spouse's employer, there is a penalty if you let too much time go by without being covered and not signing up for your Part B. So that's something to think about as far as, you know, when you're planning for Medicare, that you are going to pay for the monthly premium to have the Medicare, and that there is an adjustment that can be made on Medicare if you're, or the premium for Part B if you're a higher income earner. And the coverage is basically you can go to any physician who accepts Medicare, and if some preventative health care is provided. So what's not covered with Part A and Part B? In Original Medicare, what is not covered, you've got the Part A and Part B deductibles, the co-insurance, and the premiums. We're going to talk a little bit later about how to cover some of that, but that's not covered by Original Medicare. The deductibles, the co-insurance, and the premiums. Part B excess charges, outpatient prescription drugs, additional benefits such as hearing, vision, and most dental, and then long-term care or custodial care. Those are not covered by Original Medicare. Okay, so another coverage having to do with Medicare is Part D, D for drugs, prescription drug plans. That's something that is going to come up. It's not something that you will sign up for on ssa.gov when you go to put your Medicare application in, but it is a coverage that's important that you have to think about. Prescription drug plans help with the cost of your prescription drugs. This coverage is only offered through private insurance companies. This is not part of that federal program, the A or the B. You must continue to pay your Part B premiums, and for medications that you receive, basically, prescription drug plans help with medications that you receive from a retail or mail order pharmacy. So some medications that you may take or you may have given to you in a doctor's office setting, sometimes those are covered under Part B. But if you think about when the doctor gives you the prescription and you head over to the pharmacy to get it filled, that's where the prescription drug plan is going to come in. So the costs are going to vary from plan to plan. They change every single year. So the coverage varies, the costs vary. Catastrophic coverage is going to protect you from high drug costs. The benefits can change from year to year. There's going to be a lot more that has to do with prescription drug plans over the next 2 years, because there are some changes that have been made already from the Inflation Reduction Act. And this year, next year, in 2025, the conversation we're having right now about what's going on with prescription drug coverage and the phases, those things are going to change. That discussion is going to change. But as it is right now in 2023, we're going to review some of the aspects to it. But no, keep in mind in the back of your head that prescription drug, a lot of it's changing. The enrollment, the coverage is not automatic. You must enroll in a prescription drug plan yourself, basically. It's not something that's going to be automatic by enrolling in Medicare Part A and B. And then if you go without prescription drug coverage, either through a Part D plan or through an employer, again, with creditable insurance, they would apply penalties if you enroll late. So each plan has a list of drugs that it covers called the formulary, and the list of drugs can change throughout the year.
So let's just take a quick second there. Let's say, I turn age 65, I get enrolled into Medicare, I'm on Part A and B, and then I, when I first enroll, I'm not taking any prescriptions or anything along those lines. So I say, I don't need the prescription drug coverage. Right. And then I get, into a car accident and all of a sudden, have something prescribed to help with the recovery from that. I'm fully out of pocket for those prescriptions that come at that point, correct?
Correct. So you're out of pocket on those prescriptions. Maybe you might be able to come, find something to help you with the cost of the prescriptions. But where it gets tricky is that if something happens down the road, if the car accident causes something that you now really do need to continue taking medications, and where you turned 65 and you were a person who was not taking anything prescribed, now you're 67, 68, 72, and what your prescriptions look like could be totally different. If you did not enroll in a Part D plan when you were first eligible for it, then there's a penalty, and they do not eliminate the penalty. The penalty is there for as long as you are then enrolled in a Part D plan. So it does not go away. So anyone that I talk to, if you're turning 65, you've put yourself in a fantastic spot as far as if you can, reduce your medications, through lifestyle changes, whatever the situation may be. If you are not taking anything, that's fantastic, because you can shop for any plan that you want. You're kind of just deciding, hey, I want this plan based on cost. I want this plan based on better benefits, whatever. But you do want to make sure that you have some type of Part D coverage when you're eligible for Medicare, because like I said, that penalty doesn't go away if one day you do decide that you need to enroll in a Part D plan.
All right, Marcus has his hand up. Yeah.
Yeah, how difficult is it to find a prescription drug plan?
So it's
what's
not
the best way to go about that?
Yeah, it's not difficult at all. All the prescription drug plans that are available each year are on Medicare.gov. If you're working with a licensed insurance agent, like in my situation, that's what I am, that's what I do. We look at prescription drug plans that are available that year. So, a lot of times you'll have someone who is not taking anything, and they'll pick a plan based on the situation at that time. And then maybe, 6 months goes by, we're not in an eligible enrollment period, but now they've been prescribed something. That's something you want to look at every single year, because if you want to get onto a plan for the following year, for January of the following year, you want to make sure that you've reviewed or you've gotten onto a plan that's appropriate for, the next calendar year. But they are on Medicare.gov. If you wanted to research it yourself, if you have your own profile on Medicare.gov, you can store your information in there with your medications in there, and it'll help you filter it out. That's something that I do also, for clients, because that's just part of Medicare.
Excellent. All right, awesome. Well, let's go ahead and keep it moving then. Oh, and here talks a little bit more about that Part D formulary. So
yeah, the formulary. So every plan is going to come with its own formulary, and those formularies do vary a little bit from plan to plan. The formulary is the list of drugs that are covered by that plan. So a certain drug may be covered by one plan, but not covered by another. You always want to review that. That's probably the most important part of choosing your Part D coverage, whether you're getting your Part D through your a standalone prescription drug plan, or it's included in, say, a Medicare Advantage plan. You want to be able to make sure that your medications are covered with cost sharing that, works for you. If, we can make that happen. All plans have a tiered formulary. Generally, the lower the tier, the lower the out-of-pocket costs. So your tier 1 generics, sometimes you can get those for free. Sometimes you can get those for free. Even right now, if you were to walk into a pharmacy and you needed something that's a very common, say, antibiotic. I have walked up to a pharmacy in Glen Allen and picked up a brochure they had on the counter, and there were certain medications that they gave for free with no insurance. But generally speaking, when you're turning 65 and you're looking at your Part D drug plans, the lower the tier, the lower the cost to you.
And so a question here as well, like say, I go to enroll in that Part D plan, or let's say Marcus and I go at the same time and pick the same plan. Is there any type of differentiation in cost, or is it just a flat, based on, the type of plan that you're getting?
Yeah, there's no differentiation, whether it's, a husband, a wife, maybe you're 65 and, Marcus is 75. There's no difference in the cost. If you're picking a certain plan and maybe they have, 3 different levels of plans offered, and you both choose the same level of the same plan, you're both going to say that pay the same price.
Excellent. Okay, great.
Yeah. So the coverage stages. The coverage stages is something that if you take a lot of medicines, it's something you're going to get familiar with pretty quickly. If you're not taking anything, this might be some information that's stored in the back of your head. Maybe you've heard about this from a parent. I have some people that sit down, they're not taking anything. They're not going to deal with the coverage stages anytime soon, hopefully never. But the coverage stages are there to sort of protect you as far as the potential for having high out-of-pocket costs when it comes to medications. So the first stage is the annual deductible, and not all plans have a deductible. So that's the initial. Depending on the tier of the medication, they could apply the deductible, and that's the initial. So if you're taking something that's a higher tier, you go to the pharmacy and you have a plan that has a deductible, that's the first thing that's going to apply. Then you move into the initial coverage phase. So initial coverage for 2023 means that you and your plan have spent up to $4,660. That's kind of a hard thing to figure out on your own, because you're dealing with not just your costs, but also what the plan is paying for that medication. In 2024, that number is going up to $5,030. But this particular slide is showing us what it looks like in 2023. So the numbers for the drug phases and some things about it have already been released, and it is going up a little bit for 2024. the coverage gap or the donut hole. That's a phone call I get when someone is taking an expensive medication and all of a sudden they go to fill it and now it's more money than they've paid the entire year. And they said, the pharmacist told me that I'm in the coverage gap or I'm in the donut hole. So now you're spending more money to get that prescription filled. Generally, it's about 25% of that cost until the true out-of-pocket your spending reaches $7,400 for this year. Once you get to that $7,400, you're in catastrophic. And then you're in catastrophic through the end of the year. So your cost through the end of the year this year is going to be a small percentage. It's 5%. Next year in 2024, they are changing that so that there is no cost to the consumer once you've reached catastrophic. So you will pay nothing if you've gone through the initial coverage stages and then reached catastrophic. So that's something that has also changed from the Inflation Reduction Act.
That is good to know.
Yeah. So the cost sharing, like we talked about a little bit, cost sharing for 2023, the annual deductible is up to $505, but not all plans have a deductible. So up to $505 means that Medicare is saying you can have no deductible, you can have a lower deductible, but to be a Part D plan through Medicare, you cannot offer a plan with a higher deductible than $505. In 2024, that number is changing. That's moving up to $545. So 2023, the annual deductible for Part D plans is up to $505. The initial coverage limit for 2023 is up to $4,660. The coverage gap or the donut hole, you're going to pay the 25% is your cost share for the covered drugs. And then like we were talking about, the catastrophic is $7,400 and above. And that's when drug copays are reduced. Generics, $4.15 or 5%, whichever is greater, and brands are $10.35 or 5%, whichever is greater.
Awesome. All right, before we move on, we got a question on the tiers.
Okay.
So it says, question is, what's the difference between cost tiers under Plan B? Looks like it gets increasingly expensive, but why?
The cost tiers under Part D plans?
Correct, yes.
So the plan assigns the tier based on the retail cost of the medication. So an expensive medicine from the manufacturer is going to get a higher tier assigned to it. Why do they assign it a higher tier? It kind of, you're going to pay more. Your cost share is going to be more. The plan's cost share is going to be more because the manufacturer is charging a higher amount for that medication. Sometimes there are things that you can do with your doctor's help. You can apply to try to get like a tier exception. If you're on a plan, maybe that particular plan is tiered a medication for you that is maybe a tier 4. And if you could just bring it down into a tier 3, it would really change a lot as far as your cost sharing. There's certain things you can do as far as that goes. But generally, when you see a tier 5 or a tier 6, that means the manufacturer is charging a lot of money for that medication. And so the plan and the consumer will end up paying more on their side also.
So, okay. I think I understand this a little bit better now. So the tiers apply to the medication itself.
Yes.
Not to, like, you don't get a Part D plan that's tier 4.
No.
Right, and covers
Right.
tier 4 and down.
So every Part D plan has a list. There's there's a booklet, or you can go online and access the list. And if you're taking medications, you can go in and see, hey, okay, well, this plan assigns this medicine as a tier 3. This one's put the medicine at a tier 2. And that's how you're kind of comparing the plans, because if you are taking more expensive medications, that's going to make a difference for you at the pharmacy. And that's really what I would say would probably be the biggest factor when you're looking at what prescription drug plan you may want to enroll in, is your cost at the pharmacy at the end of the day.
Okay. hopefully that answers that question. And we'll move on now to Part C.
Part C. So Medicare kind of made this a little bit confusing because they took Part A, Part B, Part D, rolled them together into a Part C. Now, not every Part C includes Part D, but generally for the purposes of this discussion, because a lot of them do, we will say Part A, Part B, Part D equals Part C, and that's your Medicare Advantage plan. That is what
A
you are going to
plus
see.
B plus D equals C.
Exactly.
Got it. Right back in trigonometry.
Yes, exactly.
All right.
So Medicare Advantage plans, they're combining your A, your B, and may also include that prescription drug coverage. These are offered by private insurance companies, and they often include additional benefits above and beyond original Medicare, but it varies by the plan. These plans are probably what you hear the most about when you hear about Medicare on TV or in the mailbox. It is private insurance companies wanting you to enroll in their plan, making ads with celebrities to get you to call in and sign up and basically be covered by them, by that private insurance company for your Medicare coverage. The eligibility for a Part C plan is that you must be enrolled in A and B. They will verify that before it's processed. You have to be enrolled in Part A and Part B. You must live in the plan's service area, and you must be able to make an informed decision. Plan service area meaning county-based. So they're going to look at your zip code. They're going to look at your county because plans vary by county. I personally am sitting in an office right now in Hanover County. Caroline County is not that far away. They have different plan offerings. It varies by county. And in Virginia, you know, you've got several different areas. You got Northern Virginia, you have Richmond, you have Tidewater. There's different aspects to how the plans are available in Virginia. So if you move, you would look and see if your plan's still available in that area. And if not, you'd have to enroll in a new plan.
And that's probably the case for, you know, the folks here on this call where, you know, just looking at kind of the attendees that are on right now, we've got probably 7, 8, 10 different, you know, counties or locations represented.
Oh yeah.
So, you know, how much variation is there from a Hanover to Richmond or from a Richmond to Fairfax, Ashburn?
I would say it's significant, Richmond to Fairfax. Hanover is kind of grouped into the Hanover, City of Richmond, Henrico County, Chesterfield County. Those are all kind of grouped together. You'll generally see the same things that are available in those counties. But for some reason, you know, Caroline changes it, Louisa changes it, King William changes it. You know, the plan offerings are, I mean, they're not too much different, but they are different.
Okay.
Yeah.
So that's why it's important to, you know, schedule some time to kind of, you know, meet with Jennifer, somebody like her, to, you know, go through this and look at, you know,
Yes.
what's available where you are as well.
Someone that you can sit down and talk with or talk over the phone that you trust, because the ads on the TV are trying to get you to sign up for what they're talking about. You want to enroll in not just, okay, this is my zip code, give me a plan. You want to enroll, there's several different things to the picture you want to look at to be able to decide. I mean, one thing we just talked about was the drug portion. You get into Medicare Advantage, you're going to see a little bit more. You want to look at some other things too. You want to look at doctors, you want to look at networks, you know, things like that.
So is it also service offerings as well as the premiums? Like, can one company have different premiums based on just location?
Yes. Yes. So if you
we did have another question, but I may have to table that question for a different segment of the presentation, if that's okay. But
okay.
Yeah.
So the costs with an advantage plan, they can change from year to year. You must continue to pay your Part B premium to stay enrolled in a Medicare Advantage plan. If you stop paying your Part B, all of a sudden they'll disenroll you from an Advantage plan. As far as coverage goes, many plans include the prescription drug coverage. And coverage can be limited to a service area unless it's an emergency, can be. So that depends on the situation. You may be required to use a network of doctors and hospitals. And the plans may include additional benefits above and beyond original Medicare. That varies by plan and that changes from year to year. We find out what's available for 2024 in the fall. So October 1st, it gets published. We see what's available. That's the time to reassess your needs. You know, you just don't know. Sometimes when you're picking out Medicare, what you choose when you're 65 is not necessarily what you need when you're 70. And every year with Medicare, you have the opportunity to review, see what's out there, and make changes based on what's in your best interest.
Excellent.
The types of Part C plans. So you've got coordinated care plans, you've got your HMOs, which you may be familiar with from insurance through, your employer. So health maintenance organization, an HMO, a health maintenance organization point of service, HMO, POS, a PPO, preferred provider organization, and then special needs plans, SNPs. There's other plans. They're out there, but you don't want to see them too much. The private fee for service plans, the Medicare savings account plans, and then Medicare cost plans. So the alternative to being covered by a Medicare Advantage plan is to stay on to original Medicare. You've got your A and your B. And remember at the beginning, we talked about there was some cost share involved for you as the consumer on A and B, and the protection, or the way to get the protection, we'll say, for that cost share would be looking at a Medicare supplements. And sometimes people use the word Medicare supplement like, well, I have a supplement, and they're meaning sort of in addition to Medicare, and they might mean an Advantage plan. But in the world of Medicare, a Medicare supplement is something very specific. A Medicare Advantage plan is not a Medicare supplement. A Medicare supplement is a plan that is in addition to your original Medicare. So Medicare supplement insurance helps cover the gaps in original Medicare. We talked in the very first couple of slides about how if Part B, if you have something done under Part B, if a service is covered under Part B, that Medicare is going to cover it generally at 80%. And that other 20% was your responsibility. That's where the Medicare supplement comes into play to kind of help you with that and stop that out-of-pocket max that has no limit when it comes to your cost sharing on the 20%. So these Medicare supplements are also sold by private insurance companies. They have names that are letters. So A, B, C, D, F, G, K, L, M, N, a high deductible F, and a high deductible plan G. I have seen people with a variety of these letters. Some of them are old, some of them are not available anymore. Some of them you can still kind of be grandfathered into a plan. For the most part, if you're turning 65, if you turn 65 in the since 2020, we'll say, F stopped being available. A lot of people are looking at G, Plan G. You might have a neighbor, if you're on original Medicare and you have a supplement, what do you have? A lot of people will say they have Plan G. Some will say they have Plan N. I've run into people who have the high deductible plans. Kind of depends on where you're at with it, as far as which one you would have or which one you would want. But don't be overwhelmed by all these letters. You kind of just want to think of it, a lot of people that I sit down with, they have a Plan F, they have a Plan G. Massachusetts, Minnesota, and Wisconsin have some different standardized plans, and the benefits can vary by plan and when your Medicare coverage began. Basically, some plans are no longer available.
Jennifer, what do they have against the letter E?
I don't know.
And the letter J?
I don't know.
Great letters, as you and I are a testament to, obviously.
Exactly. Why don't we have our own plan letter? I don't know.
All right, we got a couple more questions that came in here, and I know Marcus has his hand up here. So,
okay,
Marcus, what do you got?
Well, no, I was actually going to refer to the Q&A. So there was one question that was just asking for extra clarification between the differences of a PPO and a HMO. Are you able to provide more of an in-depth clarification on that?
Yeah, so a PPO, preferred provider organization, it's also a network, but generally those plans allow you to go outside of the network and still give you coverage. Many times that coverage has a higher cost share to you, but you can generally go outside of the plan's network. And as long as the provider is willing to accept the terms of the plan, as far as that goes with the billing and everything, you may pay a higher cost, but you can generally see someone who is not in the network and it not be an emergency. An HMO, a health maintenance organization, that is very network driven. That is something where you see people who can't go to the doctor anymore if that doctor's not in the network. You are covered on an HMO if it's an emergency. So if you're on an HMO and you're traveling and something happens to you and you get taken to the hospital, you're in an accident, you're covered because it's an emergency. But as far as say you're visiting someone in another state and you want to just, go have something on your skin looked at, that's generally not considered an emergency. And you would have to make sure that doctor's in the network, which that's not to say that the doctor wouldn't be in the network. It's just that that's something you need to make sure that they're in the network before you go and see them so that you are covered. So HMO, you need to stay in the network. Otherwise, it's not going to be covered unless it's an emergency. PPO, you've got some more freedom to go in and out of the network.
And then there was also a question, maybe just looking for a little bit more clarification again on the differences of, or the advantage rather, of Part C and Medicare supplements, because it sounds like there's a difference between Part C and a supplemental plan.
Yes.
But can you just highlight the advantages of the two as well?
So that's like the biggest debate when it comes to insurance. When you want to talk, when I sit down with people, the first thing we want to talk about is here's the pros and here's the cons. And you kind of know where you're at if you know what they are. If you know what the pros and cons are, you kind of know which way you're leaning. Some people walk in and they know what they want. They already know. They've already talked to, 10 different people. They've been told, good stories or bad stories by, their neighbors or their parents, or I have heard so many people talk to me about how their parent had this, that, or, whatever their plan was. And they were very familiar with how that worked. So with original Medicare and a supplement, you're going to pay up front. You're going to pay every month for that premium. You have to pay Part B on both sides, Medicare Advantage or Medicare with a supplement. Part B, that cost is there. But with a Medicare supplement, you're going to generally pay a premium to have the supplement each month. You're going to pay a premium for that Part D plan each month. And then your costs are going to be more predictable. You know what you're going to pay every month. You know that, if you have to pay the Part B deductible in 2023, then that means the first time you go and have some things done that year, I had someone who had a sleep study and they had the bill and they were like, what is this for? Well, they hadn't met the Part B deductible yet. So once you paid that $226 in 2023, you're paying your Medicare supplement premium, paying your Part B, you've got that. Maybe you've already met the $226 deductible. Basically everything, if you go to the doctor for the rest of the year, you're not going to have co-pays. You're not going to have co-insurance. You're not going to have a daily cost co-pay if you're in the hospital. You could not go to the doctor at all for the rest of the year. You could not step foot in a doctor's office. You could not step foot in a hospital. You're still going to pay the same thing. You're going to pay that supplement premium, and you're going to pay your Part B, and then maybe you don't use it. So that's one way of doing it. It's how you tolerate risk. Some people want to pay that number up front. They like that. They like to know what it's going to be. What's a drawback to it? The premiums generally go up each year. Occasionally they've stayed stable, I would say. But in general, as you age, as companies make rate changes, you'll see those premiums rise. The rate for a 65-year-old is not going to be the rate for a 75-year-old. And you're not getting anything extra. You're getting what Medicare offers. So I had someone go to the doctor recently and she wanted to have something done. And somebody at the doctor's office told her she was on original Medicare with a supplement. And they said, well, I don't know if your insurance covers that. And I said, well, you have original Medicare. It's and she wanted to know if the plan she was on would affect whether or not she could get this particular thing done at the doctor's office. And I said, it's Medicare. It's whether or not Medicare says that that's covered. And Medicare does have a list of things that are covered and not covered. But, you know, that's something that some people find as a negative is, you know, maybe they want the extra stuff. They might see the stuff on TV for what Medicare Advantages offer that's above and beyond Medicare. You know, you're talking dental, vision, hearing, sometimes transportation. There's different things. And they're looking at that and they're wondering, okay, on original Medicare, what do I get? How do I get that coverage? You might have to pay for a plan. You might have to go and get a standalone dental plan or, you know, something along those lines. Advantage plan, you're going to pay as you go. It may have a premium. Some of them, if you'll see $0 plans, that means that plan doesn't have a premium associated with it, but you're going to pay as you use it. You might have copays if you go see a specialist. You might have copays if you're in the hospital, could be by the day, could be by the stay. It depends. All the plans vary, so they're not going to be identical across the board. The benefits are going to be a little bit different as far as if they offer anything extra, what that extra benefit is. There's little nuances to each one of them, pluses and minuses, right, just like anything else.
Okay. Perfect. All right. Hopefully that answers that question there as well. I think this is where we had left off here, right?
Yeah. So like we said, with a supplement, you have to be enrolled in A and B, be a resident of the state for where you're applying for coverage. And you have to be over the age of 65 or under 65 in certain states. Who would be eligible for Medicare under 65? Like we said in the beginning, certain disabilities will kick in Medicare coverage, and certain conditions would kick in Medicare coverage. And in those cases, that's when you would see someone who is getting onto a Medicare supplement under the age of 65. So Medicare supplement insurance helps with some of the out-of-pocket costs that are not covered by original Medicare. The premiums can vary based on your age, your sex, tobacco usage, zip code, the plan, the carrier. The best time to enroll in a Medicare supplement is during the 6-month open enrollment period following your 65th birthday month or your Part B effective date, if that happens to be later than your 65th birthday. And then there's other situations in which your acceptance may be guaranteed, but generally, as long as you're enrolling in when you're initially eligible, your acceptance is going to be guaranteed. Okay, so plan choices. You are eligible for Medicare, you've enrolled in original Medicare, and now you're deciding about getting the additional coverage. So you've got original Medicare provided by the government, and then option 1 or option 2. So this is not, you cannot do both. You're choosing between option 1 and option 2, but step 1 is going to be enrolling in original Medicare and then deciding whether or not you want to go with option 1, which is Medicare supplement insurance offered by private insurance companies, as well as a Part D prescription drug plan that would go with, Medicare and the supplement. Or option 2 would be Part C, which is the Medicare Advantage plan, which is the combination of Part A and Part B. And generally Part D, although some people don't need Part D, that's kind of a unique situation, but I have come across that. There are certain people who do not need Part D, don't get Part D, and so they're just getting a Part C that has A and B coverage and then some additional benefits.
All right, so I think right now might be a good time to answer this other question that came in earlier,
Okay.
which is, what do I need to do if I'm still working at age 65? Should I sign up for A and B and as well as Part D? Right. And I think that this might also be asking, or, can I just stay on my employer's plan
So that's going to be in a couple slides, 2 or 3 slides down the presentation. And it is going to depend on the size of the company that you work for.
Perfect. Here we go. When can I enroll?
When can I enroll? So your Medicare initial enrollment period, you have the 3 months before, the month of, and the 3 months after your 65th birthday. So that is generally your initial eligibility period of when you can enroll in Medicare. And let me just add this. If you are married and your spouse is 65 and they're eligible for Medicare and you were covered under their group's insurance, and now they're getting off of the group, or maybe they've decided I'm done, I'm ready to retire, I want to get on Medicare, I'm not going to be at this job anymore, which means maybe I don't have this coverage available to me. Medicare is very much an individual situation. So the spouse that is not 65 will need to have a backup plan to cover them until they're 65. So if you're working past 65, you can enroll in Parts A and B, but it's recommended that you speak with your benefits administrator, and you always want to keep records that you have that health insurance coverage through your work. They will want to verify if you wait until after 65 to enroll, they're going to want to verify that you were covered after 65 during that eligibility period. So if you enroll after 65, when you're retiring, you may be eligible for a special enrollment period that will allow you to enroll in original Medicare for up to 8 months after the loss of employment or employer coverage, whichever happens first. And you can also enroll in a Medicare Advantage plan or prescription drug plan for up to 2 full months after the loss of the employer health benefits. So if you are going to continue working, you want to pay attention to whether or not you need to enroll in Medicare. You may not need to. And then if you are going to delay it, you just want to make sure that you've talked to your benefits administrator, your coverage is considered creditable by Medicare, basically, and they know. And then when you go to enroll, they're going to want to see, sometimes they'll ask for a verification, kind of an attachment in the application to show this was my coverage that I've had this entire time. So if you're new to Medicare, working beyond 65, but you have fewer than 20 employees at your place that you work, you will want to enroll in Medicare A and B during that initial eligibility period, the 3 months before, the month of, and the 3 months after. If you're going to work after 65 and you have under 20 employees, you want to make sure you enroll in Part A and Part B. Why? Because Medicare is primary. So if you were to go into the hospital or you were to have a claim, you're with a small group, Medicare pays primary. Your works insurance is secondary. The Medicare supplement open enrollment is 6 months. It's a period that lasts for 6 months and begins on the first day of the month in which you're 65 or older and enrolled in Medicare Part B. So from the time that you get your Part B in place, you have that 6-month window where you can generally apply for a supplement, whichever one you want. They're not going to ask you health underwriting questions, and you'll be able to choose the supplement that you want. If you let that window go by and you haven't enrolled, say a year or two goes by and you say, well, I think I want a Medicare supplement now, but I've already been on Medicare and I haven't had any group insurance, they're going to ask you some health underwriting questions to get that supplement. So there's additional election periods, and this is something that, you do see on TV, you do see in the mailbox. It has to do with these additional election periods, because every single person who's on Medicare is eligible during the annual enrollment period, which is October 15th through December 7th, to make their changes for January 1st. So like I said, October 1st, everything's published. We can see what's out there. If you're already on Medicare, say you're on a Part D plan and you want to see if you're on the right Part D plan for next year, October 1st is when we see what's there. October 15th to December 7th is your time to get the application in. The last application that's in on December 7th is the one you're going to be on for January 1st. Recently, I say recently, it was the last couple of years, I think it was 2-3 years ago, they started the open enrollment period. So the open enrollment period, think of as a correction. You're not going to see, or you should not be seeing, the same type of advertisements, the tons of phone calls. Basically, this period is designed as a correction. So January 1st through March 31st, you can change from one Medicare Advantage plan to another, or back to original Medicare with or without Part D coverage. This means that maybe you were on an Advantage plan and you didn't make a change in time, or you did pick an Advantage plan and it wasn't the right one. You changed to a different Advantage plan from what you had. Now you found out your doctor's not in network. You want to keep that doctor. You use this time to make a one-time switch. Maybe you enrolled in an Advantage plan and you said, no, I think I want to go back to original Medicare with a drug plan. These are the 3 months to do it in. You get the one-time opportunity. And then there's special enrollment periods, SEPs. And this is for if you're moving to a new area, if your plan was discontinued, if you're receiving skilled nursing care, or if things that have to do with your income have changed that pushed you into a lower income where you need assistance as far as maybe with prescription drugs, if you qualify for that, or if you're eligible for Medicaid, that opens up enrollment periods for you to make some changes.
Perfect. So I know one question that I've gotten, in the past a number of times is, hey, I've been on Medicare. I'm 73 years old, been on Medicare for years. Why do I need to review it?
Well, the thing about it is with Medicare, if you're on a Medicare Advantage plan, those plans do change from year to year, depending on, where you are. Sometimes there's plans that come in, their benefits might be a little bit different, and they might be, in your opinion, better for you. And it's always a good idea to look at it. If you're on original Medicare with a supplement, you can shop your supplement throughout the year. If you're, if it's June and your premium went up on your Medicare supplement, and you're like, you know what, I'm a pretty healthy person, and these premiums are getting to be a little bit high. I wonder if there's anything else out there. You can always shop that supplement. That supplement is not subject to these enrollment periods, but the drug plan is. So if you're 73 and you've been on Medicare for all these years, and you're on the same drug plan, and occasionally I've come across this where someone just lets looking at the drug plan kind of go off to the side, and then all of a sudden we're looking and we're like, what are you taking? And we're looking at their medication and we're looking at the cost of the drug plan, and they just don't match up. You might not need that plan, may need a better plan. You always want to you always want to review it in the fall. And if you do need to make an enrollment change, that's the time to do it. But it's always good to take a look at it, even if you don't want to change at all. You don't have to change. It's not required, but it's good to look at it.
Perfect. Excellent.
Yeah.
Oh, there we are. Okay.
So, well, I think there was one more slide that just talked about the next steps. There we go.
Oh, I'm sorry.
That's okay.
Over that.
That's okay. So next steps, you just want to review those enrollment periods. You want to research your options, ask questions, seek help, enroll, and always make sure you do a yearly review.
Perfect. Okay, well, thank you so much, Jennifer. Marcus, I think you've got a couple of things you want to add, but thank you so much for walking us through this info, Jennifer.
I'm chock filled with questions, but I know we're past our planned time, so I'll just ask one of two questions. One, what is the order of precedence with Medicare and group plans or retiree group plans? I know you mentioned it before, but there tends to be some confusion about that. So, which insurance typically processes a claim first and which one comes in second?
So it depends on the size of the group. If you're still working and that group is a large group, you're working for the county, you're working for Verizon, you're working for someone a place that has thousands of employees, you're not necessarily going to need to sign up for Medicare because the coverage is going to be there through your group's insurance. If you decide you don't want it, Medicare is there for you. If your group is under 20 employees, then they process it where Medicare processes first, then the group pays their portion after Medicare pays their portion. Retiree plans, if you've stopped working, but say you work for a county or a town or a company that has specific retiree plans that are available, you want to look at those and kind of compare it to what's out there with original Medicare, because I've seen retiree plans where it's a really great plan, but the cost is a lot. And sometimes those come with situations where if you don't enroll in them when you're initially eligible, you can't get them later on. But it's always a good idea to look, because if the retiree plan is a great plan compared to Medicare, you're getting identical coverage or almost identical coverage, and you're not really paying anything for it due to your years of service. A lot of times I say, when I'm looking at those, comparing it to what's out there on, just original Medicare plus a supplement or a Medicare Advantage plan, the retiree plan might make the most sense, but sometimes they don't. So it's always a good idea to see what your situation is, because maybe your years of service might affect the premium. Maybe if you're the spouse, you're not getting any help with your premiums, and it doesn't make sense to keep it.
Perfect.
And I'll say my last question is we highlighted the next steps. Do you mind just sharing, what an experience in consulting with you would look like, guiding somebody through the next steps of enrolling for Medicare and analyzing those options?
Yeah, definitely. So I like to talk with people as soon as they kind of realize their Medicare is on the horizon, because you can get onto ssa.gov 3 months before your 65th birthday. And some people like to do this by themselves. Some people, want some assistance, but that's step one, is signing up for your Medicare, your A and your B. Or sometimes someone's waited and they have A, but they don't have B. And now they're like, I'm pulling the trigger. I'm retiring. I will not be there as of this date. And I say, okay, well, we know that you need Medicare for the first of the following month of when they're going to leave their work. So I'll help them enroll. Once we make sure that that's in the works, we know when it's coming, we look and see, we sit down and we look and see. If you don't know, really anything about Medicare, you're not familiar with it at all, we'll kind of go through this a little bit and then drill down into what, you have more specific questions on, because like I said, it's always good to figure out the pros and cons and see which ones are right for you. Money drives a lot of decisions. And so you want to know what that's going to look like. So sitting down, even if it's just on the phone, I say sitting down because I do meet with a lot of people in person at the office, but even if it's just on the phone, get in touch. We talk about what's available, which direction you want to go with it. And then from there, once we have confirmation that you have your Medicare number and your A and your B and the date, those things are all in place, then you can enroll in whichever plan is appropriate for you, whether it's the Medicare supplement and drug plan or the Medicare Advantage plan. We just want to make sure everything's there so that you can get yourself enrolled, hopefully in plenty of time. You can wait until the day before the first of the month if you need coverage for the first, but it's always better to do it earlier so that you have time to get your cards in case you need to go to the pharmacy right away, things like that, go to the doctor. But look at what's available, and then I help you enroll. I'm a licensed insurance agent, and so we do not get paid by the consumer. Just like with any other insurance, we're paid by the carrier. So Medicare regulates all of that, and insurance companies pay us. So when you're working with someone like me who's local, I give you the option of coming in and sitting down every year if you want to talk over the phone, whatever you want to do. But I am available. I'm not a call center, and your phone is never going to ring from me calling you from a lead, because I don't do that. I don't want it done to me, so I don't do that. So I know what those are like. I actually did a webinar last night that talked about trying to stop those calls, but I know that that's a big thing for Medicare, is your phone ringing off the hook. And so no, it's not good. Don't enroll in a plan because someone called you up and said, get this plan.
So thank you for clarifying that. That was actually one of the questions that just came in, is there a cost for any consultation or meeting with you? So thank you for explaining that you're compensated through the insurance company.
Yes, never a cost.
And then last question, which kind of ties everything for the afternoon. They wanted to know your direct contact, just how to reach out to you, how to connect with you, if you have that anywhere on slide. But I know Emmett and I, we're going to be sharing a few pieces that Jennifer shared with us to relay. That information also has her point of contact, email, phone number as well. So we do have some shareable items for some details, and I think it's the next one, there at the bottom, it has her name, her point of contact, and her email.
Yes, and
Yeah,
that's
so
kind of a
everybody
summary. Yeah.
I just was going to say, everybody who kind of tuned in today, we'll email these over to you, or if you want a hard copy, let us know and we can mail it to you as well. So,
Yeah.
Okay, awesome.
Yeah.
Excellent. Well, again, thank you so much for your help, Jennifer. And, hopefully, everybody got some great information in this Medicare 101 and felt like you're back in school in some ways, but hopefully it was beneficial and informative for everybody as well. So it's been great having you all, and we hope that you have a wonderful rest of your day. Thanks so much.
Great. Thank you. Thank